Hi, my name's Kaitlyn Barr. I'm a physical therapist with Kitsap Physical Therapy, and this video is going to be talking about osteoporosis. We're going to briefly cover what it is and some exercises that you can do to protect your bones if you have low bone density. So first of all, osteoporosis is a musculoskeletal disorder which causes compromised bone strength. It affects both the architecture and the amount of bone, which results in bones that are comparably fragile and easily fractured. While osteoporosis affects all populations, including women and men of all ages, it is more common in women and does become more common as you get older. If you have been diagnosed with osteoporosis, osteopenia, or low bone density, it's important to start looking at what you can do to help protect the density of your bones going forward. One of the ways that you can do this is through exercise. Just like muscles, bones get stronger when you use them, so using them is a really important part of protecting that bone density. The most important types of exercise for osteoporosis are impact exercises, strength exercises, aerobic, and balance exercises. So, as always, before you start a new exercise program, be sure to check in with your doctor or physical therapist about what's right for you, especially if you have any concerns or questions. While the following exercises are specifically chosen to be appropriate for those with osteoporosis, if your bones are particularly fragile, you may need to be more cautious. Also, if you've ever suffered a compression fracture to your spine as part of your osteoporosis, please be sure to call your doctor or come see a physical therapist before trying these exercises at home to make sure you're doing them appropriately and safely. Next, we're going to go through a handful of muscle and balance building exercises. For all exercises, please start with body weight movements and one set of 10. Slowly build up to 2 sets of 10, and when you feel confident, you can start with light weights. We recommend less than 3 pounds and slowly building from there. For the first exercise, all you do is place your hands on the wall for balance and rise up on your tiptoes and relax back down. You'll go about 10 times for one set. Just go ahead and continue going up and down. And if that gets too easy, you can also rise up on your tiptoes and just hold for a count of 10. For the second exercise, you'll find your same spot on the wall, back your feet away so you're leaning forwards, and then just go ahead and bend your elbows so your head comes almost down and push back up. Make sure you're bending from the ankles and not the hips as you go. And again, you'll start with one set of 10 and work your way up. The next exercise is a side plank on the wall. You'll place your hand about shoulder height, walk your feet out to the side, and then lean towards that arm. You can bend your elbow a little bit as you go. Again, make sure your hips stay in line with your shoulders and your feet, no sagging from side to side. You'll hold here for 10 seconds and then come back up. The next exercise is your basic shoulder press. You're gonna hold your weights shoulder height and press up together towards the ceiling and back down, up, back and forth for one set of 10. Again, you'll be starting weightless as you work up into weights. Just make sure you're comfortable as you go. The next set of exercises are step ups. You'll face a small step or a staircase. If you're using weights, you'll hold one in each hand. Go ahead and start stepping up and back down. Your speed is up to you. Just make sure you are safe and controlled as you go. And you will do your first set leading with your right foot, second set leading with your left foot. And for this one, I'll have you do 4 sets just to keep it even. The next exercise is your basic bridge. You'll start with your feet hip width apart, knees bent, hands by your hips. You'll raise your hips up so they're in line with your knees and shoulders, and then relax back down. Again, we'll start with one set of 10, working your way up to 3 sets of 10. If this becomes too easy, you can hold in the upper position, and you can hold, again, starting for a set of 5 seconds, raising to 10 seconds. The last exercise is a seated abdominal. I'm gonna have you cross your hands over your chest, lean backwards. You're gonna hold 10 seconds here, feeling your abs engage, and then sit back up after your 10 seconds. If 10 seconds feels too long, go ahead for 5 seconds. Again, we'll repeat 10 times. Now, most of the exercises that we just went over fall into the strength or balance category that we talked about earlier. The other 2 categories that we want to talk about really quickly are impact and aerobic exercises. Most of the time, you can get both of those in with something like a brisk walk. What it means for the aerobic is just getting your heart rate up a little. So anything you're doing where you're moving your body for more than 5 minutes falls into that category. That could be a walk, that could be a bicycle ride, you could go for a swim, you could go for a hike, anything like that will help towards that aerobic category. Impact is a little bit more specific. With impact, what we're looking for is something that's just going to jar your bones a tiny bit. For most people, a brisk walk will be enough to challenge the bones, put a little loading on them, which helps protect that bone density. If you're the type of person that gets most of your exercise through bicycling or swimming, you might look to shake it up a little bit and look for something that's going to have you coming in contact with the ground a little bit more, and that will also help protect your bones.